Hi, this is Austin Nakatsuka, and this is a video that I wanted to share of another one that I had earlier, but I kind of have this one more in closer to sort of normal time to kind of show very specifically the technique I use to remove this lens here. So this is an AR40E lens that is in the rotisserie configuration. So basically the optic, as you can see, is pointing not where it's supposed to point. It's pointing at the cornea, and it's rotated like that. But the haptics are still buried in the sclera. So the haptics are where it's supposed to be, but it's rotated. And this is a phenomenon we see commonly with the CT Lucia lens. But we don't see this very often with the AR40 lens. In fact, the only time I've ever seen it was when there were very specific causes for it. And this is what happened in this case, is that this patient, after I had done the Yamane double needle flange scleral fixation technique with the lens, then the patient subsequently developed a retinal detachment, had a retinal detachment repair with scleral buckle and gas put in the eye, and the gas bubble got between the lens and the iris, so it was pushing up against the iris and pushing back against the lens. And what happened was, with that bubble there pushing up against that lens, it gradually started to rotate like it did. And I feel that it is because the bubble pushing on it that caused it to rotate like it did here. But what I'm going to show specifically here, is how we removed this lens, because this lens, once it's scleral fixated like this with the Yamane technique, it's actually kind of difficult to remove. And the reason why is because the typical way that I would remove a CT Lucia lens, if you've ever seen that, when it's scleral fixated, it has these large haptic bulbs that you can remove the conjunctiva over it, and then you can kind of dig them out externally with a needle. So I'm going to actually try that with this lens here. I'm going to try to do that here, but it's going to be a lot more difficult because the haptic bulbs are a lot smaller than they are in a CT Lucia lens. So any lens with a PMMA haptic, like the AR40 lens or a ZA9003 or a MA60 AC lens, has haptics that are made out of PMMA, polymethyl methacrylate um, uh, haptics, and they melt a little bit differently than the lenses, the haptics made from the of the CT Lucia lens, which is made of a material called PVDF. So here you see I use my technique with a 30 gauge needle to try to dig that bulb out of there. And I'm trying to dig and I'm trying to dig, and it doesn't work. And then I hit a bleeder, of course, so I can't see. So what I'm trying to do here is I'm actually trying to grab that haptic and push it out. So I'm grabbing it from the internal approach and trying to push it out of the sclera externally, but that doesn't really work here. It's basically because that haptic bulb is so small that I can't really get a good handle on it, even with that 30 gauge needle. So it's buried so well in the sclera, and that's what I typically like about it. It buries well in there so that it doesn't hopefully have a high likelihood of eroding through the conjunctiva. And it sticks in there and can scar in there, which is what we want, typically. But now that I have to remove it, it makes it hard. So here I'm trying again, and it doesn't work. I hit another bleeder. Yeah, not fun to hit bleeders. They mess up your view, and nobody likes that. No surgeon likes that. Trying to get at it, and it's not really working. Still bleeding. Great. So then I have a different idea. So this is in real time here. Previously I kind of just fast forwarded a little bit, but this is in real time. And what I'm doing is I'm going ahead and approaching it from the inside like I did before. But what I'm going to do is I'm going to go ahead and just grab the haptic there, And instead of trying to push it out externally, I grab it and I pull it internally. Pulling, pulling. Gotta be careful not to drop the lens. Gotta be careful to pull it sort of in a manner that won't damage iris or any other structures. And I'm using that, the Malyugin manipulator instrument, to sort of push back iris and get that haptic in the configuration that I want it to be in. And there it goes. There's a little pop, and it actually came through the sclerotomy, and it came inside there. And you can see that bulb and popped into the anterior chamber. So basically what I was trying to do is push it out before externally, and it didn't work, especially because that haptic bulb is so small I can't really grab it. So I went ahead and pulled it internally, and it just popped straight through into the eye, straight through the sclera like that. And so that is both a technique that I can use to remove this lens a little easier, but it's also a warning. It's a warning because that can happen to you when you're putting too much traction or stress on the lens when you're doing this Yamane technique, and you don't want that to happen when you're fixating the lens primarily in the beginning. Now if you're removing it, okay, sure, that's great, but you don't want that to happen when you're putting your lens in there. And so if you pull too hard, that thing can pop right through, and that's just a function of the way that those little bulbs are made on the PMMA Haptics, is that they when they melt, they create these little cones, or the bulbs look like little cones. They're different looking rather than the ones on the CT Lucia lens, and they're smaller, and so they can pop right through that sclera, through the tunnel there, if you put too much pressure on them. And this has been demonstrated and shown in labs as well. So it's just you got to be careful with it. And so I'm doing the same thing here on the other side as well. Just making sure that nothing scrapes the cornea. That's the main thing, right? So I'm trying to make that lens flat there. There's viscoelastic between the lens and the cornea right now. And there, I pulled it right through, and it popped right out there. And you can see the bulb. It's really small. It's really small. And that's why it's actually hard for me to access externally. But I was able to pull it internally just like that. And now the lens is inside the eye there, okay? And then I can easily remove it, and I do so by cutting it into two pieces there in just a second. And this now is sped up, obviously, quite a bit more, just so that I can just quickly show removing this lens from the anterior chamber. It's quite simple at this point, now that I've gotten the lens up into the anterior chamber. Mainly I wanted to show how I was able to get that lens out of the eye with the PMMA Haptics. So a little trick there. Thanks.